Hey y'all, it's Nurse Ryan here. For those of you who don't know, I'm an on-call hospice nurse, and I just got off my shift, and I wanted to talk a little bit about one of the diagnoses we see in hospice, and it's called cirrhosis of the liver. So, what is cirrhosis? Cirrhosis is when you get irreversible scar tissue build up in your liver, and it makes it so your liver can't function properly. And so what does your liver do? Why does it matter? Well, your liver is a giant organ that detoxifies your blood. It aids in digestion and regulating your metabolism, but scarring disrupts the blood flow and the function, and it gives you serious problems. So we end up seeing those patients with advanced cirrhosis, and when they no longer have a long-term prognosis, then they come to us, and we take care of them. So what are the causes of cirrhosis of the liver? So the main one is probably long-term alcohol abuse. When you've had long-term heavy alcohol abuse for years and years and years, your liver eventually scars up and makes it so that it doesn't work right. You could also have hepatitis B and C. If left untreated, that could really damage your liver. Some less common things are like autoimmune diseases or something called non-alcoholic fatty liver, and then you just get that from obesity. I think they even say it's hereditary. But in hospice, we don't focus. We focus on the comfort. We just make sure that the patient's comfortable. And so there's several things we look at. Well, what are the complications? So for one, you get jaundice, and that's usually a first sign of damaging liver. You get jaundice, or you get buildup of, you get yellowing of your eyes and the skin, and that's because that's because your liver is not detoxifying. It's not helping with something called bilirubin. And once you can't process the bilirubin, you basically, it goes out to your eyes and your skin, and it makes you look yellow. Another complication is ascites. Ascites is where you have a big fluid buildup in your abdomen, and you kind of look like you're pregnant. It's just huge. After you've had cirrhosis of the liver for a while, you end up getting confused, disoriented, and then eventually, you go into a coma and you pass away. There's something called variceal bleeding, which happens often, and so you end up having internal bleeding from this. So, what does hospice do? Well, we provide emotional support, we treat your symptoms, we walk your family through each step of the way. One thing we do is we use a lot of diuretics for the ascites and edema, and these are called water pills. And water pills basically makes you urinate and gets all that extra fluid out of your body. It kind of forces it out. Pain control is critical, especially with abdominal discomfort. And if you have cancer from this, then that's critical as well. People often don't want to eat, and so you have to offer them small meals, or I always just say, put whatever they want to eat in front of them and see if they'll take a bite. Now, cirrhosis, has a stigma to it, but once you get in the hospice, it doesn't matter anymore. I mean, we're not going to treat you any different. If you've had alcohol dependency your whole life, so be it. But what we do when you come, we treat you and give you dignity and respect, and make sure that you're going to have a comfortable rest of your life. So once you get to hospice, we discuss goals of care. That's where we want to know. That's where we discuss what hospice is and make sure that if you don't want to go to the hospital, you don't have to go. If you want to die in your home, then you could die in your home. And we'll make sure that you can do that surrounded by your loved ones and family comfortably. So, cirrhosis is a complex condition, and it's physically and emotionally exhausting. Um, but by managing the symptoms and supporting families and, fostering dignity and care, we can make a difference. And so if you've if you got a prognosis where your doctors offered hospice and you think it's the right fit, call a hospice agency around you and see what they say. And then sometimes it may be the right fit for you. But hopefully this video helps a little bit. See you next time.